when we started, you had expressed you had some neck pain that was becoming
Yes.
more significant. So we've done some thermography. Thermography measures the heat pattern coming off from your body.
Okay.
The things that can change that and make it hotter are inflammation and infection. The things that can make patterns that are colder are things like decreased circulation or nerve damage.
Okay.
So those are kind of the 4 things that we look for. Basic, too hot, too cold, just right. Okay. Just like the three bears.
Right. Right.
Okay. So we're gonna take a look at a couple of your pictures here.
Okay.
So I left this one out because this does give some interesting perspective here. Okay. So generally speaking, this yellow-green is going to be our ideal.
Mm-hmm.
Okay. When it goes over in this direction, that's the colder. Okay.
Mm-hmm.
Blue and purple, hotter. White is the hottest, and red is hot. Okay.
Mm-hmm.
So we can see a big pattern happening here in the mid back,
Mm-hmm.
and I don't know if that's symptomatic or kind of feels tight on you.
Yeah.
So sometimes, yeah, it can be symptomatic, but there's definitely a pattern there. We'll look at a couple more of these as well. But what I wanted to see here was, you can see the blue up here.
Yes.
Okay, in perspective, this is an area where there's, remember we talked about if it's cool, decreased circulation or decreased nerve supply.
Ah.
Okay,
Uh-huh.
and so oftentimes with things like arthritis or degeneration, it can affect those nerves that are supplying that area of the spine. Okay, so this is the very base of the neck, right in this area here.
Mm-hmm.
Okay, we're also going to take a look up a little bit higher. Okay, so this is a strong muscular pattern. Some of the trapezius, but this is an area that is definitely out of the patterning here, and we see that kind of extending down and through here. Okay, so that makes me think: do we have some inflammation happening spine-wise? Okay, again, that can be arthritis. It could be along those lines. Okay.
Great.
All right, so just a couple of other pictures here. So this one's, some of these are hard to get in a good perspective. That's why I brought up that one first. But this again shows that base of the neck here, where we have a lot of heat coming off from these areas, okay?
Yes.
But we have that cool pattern happening here, okay? So from a spine standpoint, we have nerves that are coming out. And if that spine begins to narrow or degenerate, those nerves can be affected.
I see.
Okay. And we are probably looking at some at the base of your neck that's probably associated with some of the stiffness, tightness, things that you're experiencing. Okay. Some of those changes can be permanent, but not how you feel, because we can make a lot of improvements from a functional standpoint. Okay. And we'll start looking at those in a moment.
Okay.
Okay. Any questions so far?
No, yeah, right in here is really
Right in here?
more
No.
to the left.
Okay,
Yeah,
so
right.
this is the worst spot for you
Yeah,
here?
yeah.
Yeah. And then,
Not so bad on that side, but
yeah,
still
very,
the
very
same.
tight as well. Yeah. Okay. All right. So this was a lower portion here. So we can see this is some of the musculature, but this is a continuation from what we saw over here. Is this heat pattern coming down on the spine? Okay. So variety of things that could be. Basic thing that thermography tells us, we have some increased heat coming out from the spine, most likely related to some inflammation. Okay. So that could be some of the tightness that you're feeling in there that's associated with that. But getting that inflammation settled down is going to help you feel a lot better. Does that make sense? Okay. So that's the pattern that we looked at here. And then we have this one here. This was another focus one, but again, just seeing that lower pattern up here. As I was mentioning, there's a lot of heat comes off from in here. But there is, let's see. So this is some of that area that you're reaching right now.
Yeah, yeah.
Okay. That's some of the heat pattern. I can feel the tight. You're feeling more on that left side, but both sides are quite tight when I just touch on there. Okay. So, all right. Any questions?
No.